Well, the Wall of Honor is actually a way for us to honor the people that have really gone before us, who have been instrumental in actually creating the specialty of emergency medicine in our region. Now, emergency medicine, you need to realize, actually was born in Ohio. We are the birthplace of emergency medicine, and Dr. Rega actually and myself looked around and realized there was nobody that was really recognizing the history and the people that actually helped create emergency medicine, particularly in our region, which was one of the very first areas that actually developed emergency medicine. So this honor, this Wall of Honor, is really to show respect, to honor those people that have been instrumental in doing that. In fact, to understand emergency medicine is one of the areas of medicine where you have to function as a team. And the team, as we look at this, for us to take care of trauma patients, critical patients of any type, involve our EMS providers, our emergency nurses, and our physicians all working together. So clearly, as we looked at this Wall of Honor, as we evaluated what we needed to do as part of this, we needed to recognize all three areas for us to appropriately have a Wall of Honor for emergency medicine.
And those three areas, again, are?
Pre-hospital care, in other words, EMS providers, the emergency medical services, emergency nurses, and emergency physicians.
And to have something, this big to recognize your staff and different things, what do you think that says about the quality of, your nurses and EMS and all those people? What does it say to that?
Well, clearly, again, understand, once again, I want to make it very clear, this is a community award, this is a community effort. Even though we're recognizing this here at the University of Toledo, these are not people that necessarily were right here at the university. It's recognizing the fact that we have the finest, as the way I look at this, the finest and the best emergency care that you're going to find anywhere in the country here in Northwest Ohio. And clearly we are the birthplace, of this specialty. And everything from pre-hospital care to emergency nurses to our physicians, I feel, are the finest, the most well-trained, in providing emergency care that you will find anywhere in the country.
Okay, and so how is this going to work? You have three up there now. How is this process of adding names and such going to work on a year basis, or how?
Yes, our plan is that this is an annual event. In fact, our induction ceremony for the second annual award is going to be next Tuesday. And we plan on, once again, honoring a new awardee in the area of pre-hospital care, EMS, emergency nurses, and emergency physicians. And so we intend, going forward, to make this an annual event. We may or may not choose to recognize all three areas, but at this point, that's what we feel our role is to, again, honor those people that were prominent in this specialty, in the development of this specialty in years previous to us.
And, is there a board, or who all is deciding, who these people are that are recognized?
Well, there's a committee, and I will say Dr. Rega is ultimately responsible for that committee in organizing the people. It's a regional committee, not just, again, a hospital committee. It's a regional committee of various people in both EMS, nursing, and physician care that comprise the committee that actually nominate the people for this award.
Okay. Is there anything else I missed? Anything else we need to cover?
Well, I'll let him cover